Health officials are sounding the alarm about the rapid increase in respiratory viruses and the flu. Cases of RSV have spiked in the past couple of weeks. Many pediatric hospitals are already near capacity, with children suffering from the virus and the earlier than usual onset of the flu season. Joining me now is Dr. Charles Schlein, Senior Vice President and Chair of Pediatric Services at Northwell Health in New Rochelle, New York. Doctor, appreciate your time. I know you say that your hospital is absolutely packed with children. Give us a sense of what we're seeing, especially when it comes to the emergency department.
Yeah, we are really busy. RSV disease is typically the number one cause for admission into children's hospitals, really across the country. So this has been very, very early. Typically, we see it a little bit later in terms of the peak, where the emergency rooms really across the region and across the country are running anywhere from 50 to 100% greater in terms of the number of encounters, the number of kids really coming into those emergency departments. And then that's translating into, of course, many more admissions into the hospital with RSV disease, again, which is typically a common diagnosis. But this is really a lot and has been fairly overwhelming to the hospitals.
Yeah, let's talk about how overwhelming, because, I saw some statistics. 75% of pediatric beds are being used across the country right now. And a lot of the scenes that we're seeing, although it's children we're talking about, it kind of reminds me of, the peak bad days of COVID, right, when the hospitals are overwhelmed. Give us context here in terms of capacity and how worried we should be in terms of our health system being able to handle this increase in respiratory illness and children coming into the ER for that.
Well, I don't want to cause panic. I mean, we're able to handle what is coming in because it turns out that folks that work in children's hospital like ours, here on Long Island is, they're amazing. And we're doing things, though, that are pretty unusual, opening up units that typically don't take inpatients, doubling patients up where it is safe to do so, cohorting patients, particularly babies with the same diagnosis, in rooms that typically take one. So our nurses, our physicians, our technicians, respiratory people, are really, everybody's working overtime. Everybody's doing what they need to do. But, as is typical in our industry, but particularly with children, people are doing what they need to do.
Yeah.
It is really packed.
Well, I know, many health experts and doctors that we've spoken to, I mean, they're referring to this trio of viruses, right? The flu, RSV, and COVID-19 that's really creating this perfect storm. And of course, we're not fully in winter yet. So there's concern about what winter is going to look like. Why is there no RSV vaccine? There is one for the flu and one for COVID-19. Why not for RSV?
That's a hard question for me. I don't develop the vaccines, but it has been a difficult road to get there. I mean, we do have medications that do make it milder in some populations, like prematures and babies who are born with severe heart disease, for example. And it does work, and it does make it milder. But no, that vaccine is yet to come.
Why are we seeing such a spike in, so many children kind of flooding into the emergency rooms with RSV? And here in Atlanta, I've been speaking with the Children's Healthcare of Atlanta, and they're saying that the shift this week has now been a majority of flu cases. Last week it was RSV. But I know there's been a lot of talk about the immunity gap, COVID forcing a lot of people to wear masks, a lot of children not exposed to a lot of these viruses, and hence, their immune system not as strong to deal with all this. Would you say, though, that the viruses are also mutating or getting stronger? Is that why we're seeing such a spike?
No, I don't think so. Up here in the Northeast, we're still seeing a predominance of RSV. We haven't really got hit by flu at this point much. We know it's coming. There's no question. I don't think the RSV is mutating. I think what's happened, however, is, as is usual, it's really small babies that are mostly affected by We all get RSV. Adults get RSV disease too, but typically it's mild. It's a cold.
Right.
But young ones, have it in a much more severe way. Their airways are affected. They're smaller. The airways are smaller, which leads to more severe disease. And listen, I think it's speculation. I think with babies, in fact, not getting the passive immunity that they typically would have during COVID, being apart, mothers taking, the kinds of precautions that we all took in terms of masking and distancing, et cetera. I think that this cohort of babies is just more prone and more affected by what is a common virus.
Yeah, it's unfortunate. Well, Dr. Schlein, Charles Schlein, appreciate you joining me this morning. Thank you so much.
Yeah, guys. So as you can see, those cases are up as you would expect this time of the year. I guess it's probably worse than typical because this is the first year I'm hearing about it like that. I even believe when my oldest daughter, when she was younger, when she was a baby, I believe she had it. I ain't know what they called it. Her mom kind of dealt with it as far as her getting all the information. But I think she had it when she was a newborn. So remember, guys, keep those babies' immune systems up, okay? Supplements, get you some good quality supplements. The best quality supplements you can get, all right? Herbs, fruits, vegetables, water. Not being too pritsy with your children, letting them get outdoors, play, let them get dirty. You know what I'm saying? Let them build up their immune systems, okay? All right, guys, keep those babies healthy. All right, peace.